Welcome to COVID Q&A, your questions, our answers. Today I'm sitting down with Dr. Kristina Kline, a clinical associate professor in the Department of Family Medicine on our OU Tulsa campus. Dr. Kline will be answering a frequently asked question today. Thanks so much for joining us. The question that we have for you today, Dr. Kline, is how can I mitigate risk of exposure to COVID-19 while traveling by air and by car?
Well, this is a frequently asked question, and people are always curious about how to do this because everyone's tired of sitting at home at this point. Air travel requires spending a lot of time indoors and in security lines and in the terminals where people are congregated and there's a lot of surfaces that are frequently touched. Most viruses and germs don't spread easily, like on a flight, because of how the air circulates and the filters that are used, but sitting in close proximity to someone on a crowded flight for a prolonged time, sometimes even hours, definitely puts you at increased risk of contracting COVID. And car travel does the same thing because, again, you're in an enclosed space for prolonged periods of time. So just some general guidelines for when you travel is to always wear your mask that covers your nose and your mouth. Try to stay at least 6 feet away from people, which is about 2 arms lengths. Wash your hands as frequently as possible or use hand sanitizer. If you can, avoid people that are sick or appear ill, and then definitely avoid touching your eyes, your nose, and your mouth.
Thank you so much for your insight and your time, Dr. Kline.